You must know those medications for your NCLEX exam and understand each category, mechanism of action, nursing
Here's a
intervention. Let's go,
complete
guys.
NCLEX medication focus list, organized by category, with key points and side effects you must know. 1. Cardiovascular medications, antihypertensives, ACE inhibitors, lisinopril, enalapril, right arrow cough, angioedema, hyperkalemia, ARBs, losartan, valsartan, right arrow no cough, angioedema risk, beta blockers, metoprolol, atenolol, right arrow, bradycardia, bronchospasm, calcium channel blockers, amlodipine, diltiazem, verapamil, right arrow hypertension, bradycardia, diuretics, loop furosemide, right arrow hypokalemia, autotoxicity, thiazide, hydrochlorothiazide, right arrow hypokalemia, hyperglycemia, potassium sparing, spironolactone, right arrow hyperkalemia, gynecomastia, cardiac glycoside, digoxin, right arrow toxicity equals sign vision changes, nausea. Check HR 60 BPM. 2. Anticoagulant/antiplatelets. Heparin, right arrow monitor, APTT antidote. Protamine sulfate. Warfarin, Calmidin, right arrow monitor, INR 23 antidote. Vitamin K. Enoxaparin, Lovenox, right arrow no need for lab monitoring. Aspirin/clopidogrel, right arrow bleeding risk. 3. Respiratory medications. Bronchodilators. Albuterol, right arrow tachycardia, tremor. Theophylline, right arrow narrow therapeutic range, 10-20. Corticosteroids, inhaled, right arrow fluticasone. Budesonide, right arrow rinse mouth after use, risk of thrush. Montelukast, singular, right arrow asthma prophylaxis, not for acute attacks. 4. Antibiotics, know the classes. Penicillin/cephalosporins, right arrow allergy cross-sensitivity. Aminoglycosides, gentamicin, right arrow nephro/autotoxicity. Vancomycin, right arrow red man syndrome. Tetracyclines, doxycycline, right arrow avoid sun, not for pregnancy children. Macrolides, azithromycin, right arrow QT prolongation. Fluoroquinolones, ciprofloxacin, right arrow tendon rupture risk. 5. Endocrine medications. Diabetes, insulin types, right arrow no onset/peak/duration. Metformin, right arrow hold before contrast. GI upset, no hypoglycemia. Thyroid, levothyroxine, right arrow taken morning, empty stomach. Methimazole/PTU, right arrow monitor, WBC, risk of granulocytosis. Corticosteroids, prednisone/hydrocortisone, right arrow immunosuppression. Hyperglycemia, taper off slowly. 6. Neuro/mental health. SSRIs, sertraline, fluoxetine, right arrow serotonin syndrome, takes 4-6 weeks. TCAs, amitriptyline, right arrow anticholinergic effects. MAOIs, phenelzine, right arrow avoid tyramine foods, cheese, wine. Benzodiazepines, lorazepam, diazepam, right arrow CNS depression dependence. Lithium, right arrow therapeutic range 0.6. 1.2.